Hi, my name's Aimee Di Marco and I'm an endocrine and thyroid surgeon in London. Why I decided to become a doctor is a question that I've actually not been asked, I think, since I applied to medical school just a few years ago. But the answer actually hasn't really differed in all of that time. And I've just really loved the idea of a career which combines my interest in science and logic with teamwork alongside being able to make a real difference to people's lives, to engage with patients and to help them. So I chose my specialty for a number of reasons. I'm very fortunate in that endocrine surgery combines the fascinating diagnostics of endocrinology along with surgery, which is highly technical on an anatomically really beautiful area of the body, predominantly in the neck, and also the adrenal glands. So I get to combine these dual interests of interesting endocrinology with technical and challenging, but very pleasurable surgery, along with the fact that I get to deal with patients, some of whom may have a cancer diagnosis, who I can help in that regard, and generally endocrine surgical patients who have a cancer will generally have a very good prognosis. But I also get to help a large number of patients who don't have a cancer diagnosis, and having that mixture is really rewarding, challenging, and I find it a great way to interact with patients who I'm generally able to assist. So I grew up in London, so I haven't come very far at all. I grew up in southwest London. I went to school in southwest London, and now I work predominantly in and around west and central London. So yes, you could say that I haven't got very far at all. But this means that I've seen many changes that have happened in London over the years, as well as many changes in medicine. And I've really got to know a patient population, which I find enjoyable and rewarding. So I find many aspects of my job rewarding, but predominantly over and above all else is when I think that I've been able to engage with a patient, see them through a stressful time, and to really help someone with a problem. What do my patients value most about me? Well, I guess we'd have to ask them, but the feedback that I tend to get is that they value the opportunity to talk openly and clearly and to be helped, hopefully, to understand their condition more thoroughly. They value having the opportunity to discuss their treatment options with me. Many people assume that if they're going to come and see a surgeon, that the only recommendation and outcome will be that they should have surgery. And that's really not the case. So my patients certainly value having an open discussion. And then most of them feedback that they really appreciate both having a good outcome, as the majority of my patients do, and the fact that whatever the outcome, I'm able to support them through the process of surgery and that they feel well cared for and well looked after, both in terms of the technical aspects of my surgery and my kind of holistic and personal approach to them. So the challenges in endocrine surgery are many. I mean, we could talk about the general challenges in healthcare for hours. And I would say that in healthcare overall, the real challenge is that because of an improvement in our diagnostic capacities and access to diagnostic capacities, this means that we have an increasing number of us who have diagnoses made and then come to see a specialty such as myself. And the importance here is to tease out which of the diagnoses are really affecting a patient adversely and which of them are actually not going to cause them any harm. And that's important in surgical practice, particularly because we need to be offering treatments which are proportional to the diagnoses. So in terms of any mantras and catchphrases that I use in my work, so surgeons are highly superstitious beings, and I've worked with many, many people over the years who've introduced me to all kinds of mantras, sayings, and catchphrases. And so I have adopted many of them along the way. I don't have one single mantra that guides me, but I have a couple of guiding points. One is that I always maintain that the patient is right in the vast majority of situations, and they're there to be listened to as an equal partner in the conversation. And the other mantra along the lines of the challenges in specialisation that I discussed is that our treatment must always be proportional and appropriate for the patient's diagnosis, so that we don't end up offering an excess treatment for a more minimal diagnosis. And there are many surgical mantras which people use to describe that phenomenon. People say, perhaps the punishment must fit the crime, which I sound is a bit strong, or people may say if there is no indication there will be a complication. But the reason that we have all of these catchphrases and mantras is just to remind us that what we do does come with some risk, but it really must be outweighed by the benefit to our patients. How do I behave in frustrating, stressful and difficult situations? Well, first of all, I like to try and avoid them. So that's not to be facetious, but to say that assuming that one organises things well, anticipates and prepares, it is possible when surrounded by the right people in the right circumstances to really reduce the number of times that this will happen during the course of your working time. So in surgery, it is unavoidable that there will occasionally be stressful moments, of course. When I'm operating on somebody and it's my responsibility to treat them and keep them fit and healthy, of course, it can be extremely stressful. And for that reason, during my training, it's become an essential part to learn to manage that stress. And I've been very fortunate in working with some fantastic surgeons as my trainers and as my mentors, who show me how it's possible to do that and to actually use your stress to its best advantage. At school and at university, I did sport to a relatively high level. I used to row, and I had a rowing coach who used to say that you shouldn't be afraid of the butterflies, the feelings of adrenaline before a race or before a test, but that you should learn to make the butterflies fly in formation. And I think that's very true of surgical stress, that it is an inevitable part of our job, and we need to learn to harness it in order to improve our performance and to make ourselves better surgeons who perform a task better, even in the worst moments. So the adjectives I would use to describe endocrine surgery are that it's collaborative, it's innovative, and that it's rewarding.